Good afternoon, ladies and gentlemen. This is your wound and lymphedema bro, broadcasting from beautiful Napa Valley, California. Anyway, I'm going to talk about hypergranulation. One of the reasons why a wound will not close or resurface is the presence of hypergranulation tissues. So what are the common reasons why a wound would hypergranulate? Number one would be a silent infection. So if the wound is not looking beefy red and it's very friable, it's pale looking, so sometimes could be an indication that there is so much bioburden. The amount of bioburden is so high that it's interfering with the healing. Number two is that a draining or maximally or heavily draining wound will tend to hypergranulate. So another reason is the presence of senescent cells or senescent tissue around the wound edges, so that the wound edges cannot move. Okay, the epithelial cells there that are being formed cannot move towards the center of the wound. So therefore, the growth of granulation tissue is faster now than the movement at the edges. So the other reason is that if there is a presence of necrotic tissue around the periphery of the center of the wound, make sure that you are looking at or removing all the slab that is which are barriers for movement of the epithelial cells coming from the edges. In other words, it is just like saying that the granulation tissue is moving faster than the epithelial cells coming from the edges of the wound, if we are talking about a full thickness wound. So how do we manage hypergranulation tissue? The first thing is you manage silent infection. Number two is that you make sure that you're maximally absorbing the drainage. Use highly absorbent dressing. You start with alginates. Okay, if it's not enough, you can also use hydrofibers like your Aquacel AG, and sometimes if it's still not enough, you could use a hyper absorbent over this absorbent dressing like the Keramax. Anyway, I'm not promoting any products, and I'm just giving you an example for the sake of better understanding of what I'm talking about. Anyway, the other thing that you would do is, I already mentioned to you, you have to make sure that you are cleaning up the wound base, especially at the edges of the wound. Okay, sometimes there are some senescent cells, senescent tissue there that are just there, but they are actually obstructing the migration of epithelial cells. That's the reason why the granulation tissue is going faster than the edges, than the movement of the edges. So after managing infection and in the drainage, you can also use a pressure. Okay, use a foam dressing and put a little bit of pressure. So what I usually do is I put any foam dressing, and then I'll put ABD pad on top of the foam dressing, and I'm gonna wrap it a little bit and put an intentional little amount of pressure on the granulation tissue. And sometimes it is enough to discourage the growth of granulation tissue. If after doing that the granulation tissue is still growing, I'll reach for my silver nitrate. I burn that with silver nitrate, and sometimes it takes 1 or 2 or 3 sessions, but most of the time if I use my silver nitrate, I absorb maximally the exudates, and I use pressure and other measures. Sometimes one application of the silver nitrate is more than enough. See, it all depends. Okay, so I hope you learned something today. If you did, please go ahead and like, share, and subscribe, because this would help my channel grow. Thank you very much, and have a blessed 2023.